I am very, very glad to be able to welcome my friend Dr. Rafi Romano in this webinar. We are now friends since more than a couple years, and we were sharing many different stuff, many different passions. We were having the opportunity to meet in several places all over the world. Just to give quick introduction of Dr. Rafi Romano for the few of you that do not know him yet. I say the few of you because I'm sure that most of you watched the replay of his lecture that he was giving 2 years ago in the Froggy Days. Don't worry, for all those ones that already watched this lecture, the one of today is going to be clearly different because Dr. Romano is going to show us a lot of new clinical cases that he was treating during the two past years. Quick introduction. Rafi, you are a clinical consultant at the orthodontic department of Tel HaShomer Medical Center. You will forgive my French accent. That is not the best to pronounce all the names. In Israel, in Tel Aviv, directly. You are treasurer and secretary of the International Association of Aesthetic Dentistry, active member of the European Academy of Aesthetic Dentistry, active member of the American Association of Orthodontists, World Federation of Orthodontists, and the Scientific Council of the American Lingual Orthodontic Association, plus editor-in-chief of the Orthodontics, the Art and Practice of Dentofacial Enhancements. It makes a prettier, longer resume that you have a lot of reasons to be proud of. Congratulations for all of that, even if it make my introduction a little bit longer. I think that now we reached a good amount of people to be able to start. So you're going to show us your lecture that is named a key instrument for long-term preservation of teeth alignments at any age. Rafi, I leave you the floor and I will feel free to interrupt you during the webinar if we have some questions.
Thanks, Guillaume. I'm really delighted to be here tonight. I think that I'm the one part of the one that push to be in here tonight, and not only Froggy approached me, because as I will show you today, this is for me a game changer in my office and not just another appliance. So let's my screen. And I just want to excuse if I will have to stop my lecture in case we will have alarm. As you know, Israel is in war now, and I hope that we will have a very smooth and fluent lecture without any interruption. I want to invite you to follow me on Instagram. This is my Instagram. You are all invited to follow me. I try to share on my Instagram a lot of cases, a lot of things I'm doing. Also, my passion to football, which I share with Guillaume. Last 2 years ago, we were going on the two sides to see Paris Saint-Germain against Maccabi Haifa, my team, and it was really fun.
Who was
Of
winning?
course, yeah, of course you win, unfortunately. But you know, for us to have Messi, Neymar, and Mbappe in Haifa was probably a good highlight for us. So you are invited to follow my Instagram. I want to thank really with the bottom of my heart to Guillaume and Professor Felous and to all the MedOd team who kindly represent Froggy in Israel. And again, I pushed them, one of the nicest companies for orthodontists in Israel, and I pushed them to talk to Guillaume and do some agreement to represent Froggy in Israel. And I think it was a good decision for them because now it's one of the most popular small appliances for orthodontists and myofunctional therapists in Israel. As Guillaume said, you know, I did few things in my life. Part of them that he nicely presented are from my past. I'm now in my private clinic in Tel Aviv. I edited 5 books in dentistry. I'm Diamond Plus Invisalign user. And this is my new book that will be published probably in around 3-4 months by Quintessence Publishing. I have also articles which I publish all the time. I also share some of them on my Instagram, so you are invited to come and get some information. This is my family. I think they are, like for most of you, they are the most important thing for me, no matter what career I'm doing. I have 4 kids and still the same wife, which I think it's not something usual. So I'm really happy to have a really stable family that give me my force to do my career. This is part of my staff. I don't have a clinic like in America of 10 chairs. We have small clinic with many staff in order to give a really good attention to every patient, as I will show you today. This is a short video showing you my clinic. And of course, if any of you that is from abroad want to come and see my clinic, you can send me message. I will be happy to host you in my clinic while visiting our beautiful country. I want to start my webinar by showing you what happened 2 days ago. I was preparing this webinar, and then this nice girl, 8 years old, came for a follow-up visit. She was in my clinic in March 24. You can see immediately, and we will speak about it, the tongue thrust that she has. This picture, and this is something, a tip that I will give you. When you take pictures of a patient that has a tongue problem, a myofunctional problem, without doing anything, you will see that the tongue is just popping out with, like almost 24 hours a day. So here she is. It was in March 24. I gave her Froggy only. She came 2 days ago to my clinic, and here she is. First of all, you can see that when you take the pictures, the tongue is not there anymore. I didn't tell her anything. I didn't instruct her what to do. She just used the Froggy every day. I will tell you later what the parents are telling me from their experience from the daily routine of this patient. But look at the difference, what happened in 6 months. The overjet and the overbite is getting better. The tongue slowly disappear. And this is a process. It's not a miracle. It doesn't happen in a day. But this was, an excitement for me preparing this webinar for you today to see this nice case, which is part of hundreds of cases that I have in the last years in all the circle of the tongue, myofunctional, and the teeth. I just want to show you a case that I did in 2018. And this case was, to me, on that time, 6 years ago, it was like, obviously, a surgical case. I can see her class 3. I can see the tongue thrust. She had already orthodontic treatment in the past. And I looked at her, and on that time, 6 years ago, I thought, well, this case is definitely a surgical case. So we kind of did all the analysis. I made her an orthodontic treatment, put some things to prepare for the surgery. And here she is after surgery. Everything looks really nice. I'm really happy. And then what happened? She has fixed retainer, and I follow up, and look what happened 2 years later. 2 years later, the fixed retainer is stable, everything is good, but look, the bite start to reopen again, and reopen again. And I think part of the problem on that time, 6 years ago, I was aware of the tongue. I was aware of all the things around the myofunctional problem, but I was not fully aware of all the workflow that I will show you today to avoid this relapse that I have here. Look at another case. This is already a more new case. And I will show you, look at the tongue here, look at the open bite, look at the constriction of the arches. We will speak about all this today. Look at the big overjet here, the overjet here, the constriction of the arch. And here she is after around 5 months of treatment. Everything is closed. In this case, I do a little bit over closure. You can see the bite now is nicely covering the lower incisor. You can see how the overjet is reduced. And what I do here, and I will speak about it, I leave some attachments here, some bubbles, some composite to hold the teeth. We will speak about all this workflow today. We have many, many cases that we see, and I think part of the thing that makes us really frustrated, orthodontist, myofunctional therapist, prosthodontist, they do crowns, they do a lot of things, and then they see relapse. They see some bite opening, as you can see on the left, upper left side, asymmetrical, that start to open on the right side, more on the left. You can see the case in the upper middle where the open bite is actually happening only on the two upper incisors. You can see what happened in the lower bottom right picture, where the open bite is from 7 to 7 going in a circle, going up, creating a very anesthetic but also unstable occlusion. You can see the case here in the middle, lower middle picture, where all the muscles are very weak, are very open, are very hypotonic. And all of them are some associated with the big orthodontic problems like crowding, like constriction, that we have to look at the whole picture as we will do today. You can see these 6 cases here, how they look in the mouth, how the overjet looks, and I will explain you all the workflow, what I do, when, etc. Now, I know that many of you have attended some webinars before by Sandra, by others that talk about etiology of the tongue thrust, of the tongue malfunction. So I will not concentrate on many aspects of this etiology, but I will try to summarize. The tight tongue which my friend Eyal Botzer and the EFUNA, all the association that they created about malfunction of the mouse and the possibility to cut the frenum is something that you have to look, you have to diagnose, and you as clinician have to decide if you want to do the procedure of cutting the frenum or not. But this is one of the whole factors that you have to look when you diagnose a malfunction of the tongue. This is only one problem. There are articles that talk about cutting the tongue and showing that it doesn't help. You can adopt any article that you want. What I want to show you today is clinical workflow. What I do, I check, I look at the tongue, and as I will show you in some cases, I really think that we have to cut the frenum. Of course, I do a lot of interview to see how the sleeping habits of the patient. If it's a child, I ask the mother or father how they sleep. If they sleep with the mouth open, snoring sometimes, and having difficulties to do the position of the head in order to create more airway for them. The constriction of the arch, one of the most prominent factors in tongue problem is constriction of the maxilla. Also, narrow corridors. You can see in most of the cases that the posterior part is tilted inside. Again, this is another diagnostic factor. Another one is hypotonic muscles. When I interview the patient, I look at him and you can see the way that he's holding his muscles, very hypotonic, very open and without any tonus of the muscles. You can see also, you can talk and diagnose if patients has additional habits like thumb sucking, like other habits that accelerate or jeopardize or add more factors to the malfunction of the mouth and the tongue. Also, the lips are very difficult for the patient to close the lips. You can see that it's not only even this patient that doesn't have hypotonic muscle, he have very difficulty to close his lip, and you can see the tongue is popping out. And last is the posture. I know that there are many articles discussing the posture. I think posture is part of the problems that we have to diagnose. Not always we have the time to deal with it. Orthodontists are dealing with orthodontic treatment, and myofunctional therapists are dealing with the tongue. There are very few that are doing the whole circle together. I think one of them is, I don't know if she is with us today, is Dr. Git Davidson, but not many around the world are dealing with the connection between posture and all the rest of the function of the mouth and tongue. So my treatment plan in all cases is, first of all, eliminate the etiology. This is what we will speak today about the froggy. Regain normal occlusion, and then retain the result with full control. When I mean full control, I'm 40 years in this profession. I graduated in 1984, and until today, I have not even one single patient that I ever told him, congratulations, you finished treatment. They finish treatment when they stop using their mouth. If they use their mouth, their teeth, their muscles, they never finish treatment. So follow-up for me is for life. When I'm not here, I hope somebody else will do the follow-up. Yes, Guillaume?
I just make a quick interruption because someone asked if we can see quickly the narrow rural corridors on the previous pictures. Thank you.
Yes.
And are you having any tips on how to assess which ones are too narrow or not? Because we are not only having orthodontists that are attending the webinar tonight. So for you, it's obvious that the picture B is too narrow and that the D has the right sides. What are you exactly
Yes.
looking at to be able to make this diagnosis?
Yes, Guillaume, you remind me of my wife and my patients, meaning that you don't want to wait. I believe me, I build this lecture like a story, like a fiction movie. I will talk about it very clearly about the shape of the arch and what shape we want to get. So there
I'm
are
very
many
glad to
articles.
have been compared to your wife. I'm very glad.
Yes. Okay. Uh, there are many articles about myofunctional disorder. I think that what is common and what people understand today that this webinar, and I know we had around 600 registrants, that probably some of them will look at the webinar later on, but it means that the population of people who understand therapists and orthodontists and patients that understand that this problem is not something that is unique to somebody. It's for adults, it's for children. I think that around probably 25% of the population suffer from some degree of all malfunctional disorder. And this is why I think that we should find workflow how to deal with this myofunctional problem. I took this slide from my friend Liron Meltzer, who is the representative of MedOd for myofunctional therapists for Froggy in Israel. And you can see that in a way, we are in a cycle that each factor creates another factor, and then we get into a loop that we cannot avoid because whatever you do lead you to the next one, and you cannot get out of this loop. And what I will show you today is what I do, what workflow to get from this loop, away from this loop. Of course, our mission is to move the tongue from the poor posture to the good posture. How we do it, how we convince patients to move the tongue up to the palate and then create the whole circle of improving their swallow, improving the position of the teeth, improve the position of the lips. How we gonna do it? And now comes the froggy. I was, like many orthodontists, I was frustrated. As I showed you, I found myself sending patients again and again to myofunctional therapists to a 1 year sessions, and nothing happened. Most of the time, the patient just felt tired, did not cooperate. Myofunctional therapists felt annoyed that patients did not do their homework together as they should, and nothing happened. So I kept telling patients, you have a tongue problem. And this was just for the records in the file in case the open bite will be reopened, and then I can be protected that I already told them about it. So I was trying to look from my friends, from the internet, and I came across Professor Felus' articles and book about the froggy mouse, and I wrote to Froggy Mouse and got from Professor Felus his beautiful book and a shipment of Froggy Mouse. And I started using Froggy Mouse probably around 5, 6 years ago. And I did it selectively for very few patients because I said, let's see if it works. Let's see what happened. I don't know if it's good and I don't know if it's not good. And then I was shocked because whoever I gave this appliance, I get improvement. The improvement was between 10% to 90%, but there was always improvement and very fast. And then I decided this should be one of my main appliance to start my treatment in all cases where I had misfunction of the oral fascial apparatus. And when we will talk about it, but if I copy what is written in Froggy Mouse website, you can see that we want to move the swallowing from to become automatic. We want the tongue to be raised up automatically. We want it to be comfortable for the patient. So, and of course, we will have a discussion today, probably in the question and answer, how long it should be. If it's so good, why 15 minutes? Why not 30 minutes? Why not 17 minutes? We will talk about it, of course. Now, what for me is that something that I make a contract with my patient. When I talk to them and I tell them, where is motivation? Where is your motivation? And when we agree to be together, like I'm a trainer and they are my sport person, and we are just getting a contract, and then every day is a training day. Now, like a coach, don't think that if you are a coach for a guy that wants to win the marathon or win the Olympic Games, you can call him, once in 3 months and ask, well, is it going good? It doesn't work. If you want to do something, you have to invest as clinician from your time, from your motivation. So for me, every day is training day, not only for the patient, but also for my staff. And now you can understand better why I have like 8 girls in my office. I have a lot of missions I give to my staff, like calling the patients, like getting pictures, like talking to the mother, like getting WhatsApp, like getting a lot of follow-up as a coach and not only just to be the doctor. I feel that Froggy Mouse is like teaching how to drive. When you, some of you, I hope all of you, you are not younger than 17, 18, and you learn how to drive. And when you learn how to drive, you actually, in the beginning, you tell yourself, what should I do now? Should I look now in the mirror? Should I look in the right? Should I look in the left? Should I lift my head up when I turn right and I have to operate the winker? And after some times, you get your license. And when you get your license, you are still not a good driver. It takes you another probably few months, maybe 1 year, to become an automatic driver. Automatic driver means I do things automatically, I do them the same, but I don't need to think about it anymore. And this is exactly what happened in your brain. If your brain practice on some procedure every day, you change the position of the control in your brain on the tongue function. It is already approved by MRI. There are articles showing what Froggy is doing. To me, I don't look on articles. I look at my clinical cases. In my clinical cases, every day in my office, and again, you are invited to see, there are no fiction here. It's a daily routine. Patients slowly turn all this function to be automatic. There are many articles There is one by me that I sent to JCO, Journal of Clinical Orthodontics, and I didn't tell even Guillaume. I hope it will be accepted. It's now in review. And then soon you will see a lot of my cases and my philosophy published in the JCO. Let's discuss a little bit when I give patients the froggy mouth. I believe it's never too early, it's never too late. Meaning, for me, if I diagnose a patient, even if the patient is 6 years old or 60 years old, for me, this is a time, in the time of the diagnosis, the first appointment, the patient goes home with the froggy. I have a video showing him why, and this is already my contract with him to start our mutual cooperation. Of course, there is a level of severity of the problem, and not every case should be treated the same. In some cases that are not severe, the froggy for me is like a supplement. For some of them, it's a must. We should start with it to get a little bit improvement, a little bit of motivation. And what is more important is the understanding of the patient why he has this problem. And after some times of everyday practice, now he understands. Now you have his cooperation to send him to myofunctional therapist, to send him to do orthodontic treatment. We start our relationship immediately. Second question, for how long? Should it be like it is written in the website of Froggy or some articles, 3 to 6 months? When should we do it for 1 year, 2 years? What I suggest is individual. I give patients, I follow up. In some cases, I tell them, okay, now we move to once a month for renewing the circle. Sometimes I tell them, listen, I feel that you a little bit goes down. By the way, they always goes down. And it means that, you know, it's hard. Even if you do run, if you run like I run in running group, or you do gym, there are periods where you go down, where you lose a little bit motivation, you lose your faith, and it is important to be together with the patient, feel, and for some of them, the froggy becomes like a habit. They sit in front of the TV 15 hours, 15 minutes per day, and keep using it, strengthening their lips, and using it for more than the 6 months recommended. Should we do it before, during, or after the orthodontic treatment? It's a good question. I think that you cannot isolate the orthodontic treatment, as I will show you today, from the froggy. And I have many patients that go to another doctors, and they tell them, before I will control your tongue, I will not start orthodontic treatment. Wrong, because patients need to have an anterior oral seal in order to practice properly the tongue. So many times we should start orthodontic treatment immediately together with the froggy. Sometimes I feel that patients need more time for this mission of the froggy. So sometimes I will postpone it, not because I don't believe, but you have to understand that timing of this whole treatment should be discussed according to personality, severity of the case. But in general, for me, froggy is probably the first thing I will give, but sometimes I will start immediately also with the orthodontic treatment. Does it always work? And I think this is one of the most important points we have to discuss today. The answer is no, because there are many factors not only the tongue, many factors that influence the whole system of the oral facial function. And it always improve. It can improve 5%, it can improve 50%, it can improve 100%. So it is important to have really good conversation about expectations, because I have many myofunctional therapists that call me and said, do you think we should give Froggy? I don't see any improvement. The problem is not the patient. The problem is the expectation that the therapist feel that he has to fulfill with the patient. I feel that this appliance is part of the whole treatment. And definitely, when you strengthen the lips, when you teach the tongue where to position it, you teach the patient to swallow, you teach the patient to breathe with the mouth closed, you did your job. Did you improve everything? I'm not sure. But I always get some improvement, and this is why I give this appliance to many, many people. How we measure the improvement. And this is another tip that I will show you today. You do documentation. Today, you don't need an SLR camera. You take your mobile phone and you will see how I take the picture. You can buy cheek retractor in eBay for around €1. Give it to the patient at home. Patients send me pictures like every week, and I can see, I can motivate them, I can control what they are doing, and it's good for you to compare, like I showed you in the beginning of the lecture, how to compare your results. Cost versus benefit. Let's be serious. The cost of the Froggy is so ridiculous comparing to all the treatment. Even to go to myofunctional therapist for 1 year costs a lot of money. To go to orthodontic treatment will cost a lot of money. The Froggy is like a supplement that I believe I should give to the patient immediately. This is not a matter of how much it costs, because this is not relevant when you want to address such a problem. And what I do, and this is my workflow, I start immediately, and patient feel that in the first appointment, his problem is already addressed. And this is a very psychological important thing, that he feels that he is already in treatment. He went home after the consultation and start treatment. And something is happening. We don't know what, but something is starting happening. So I made also a lot of videos to my patients, as you can see here. And the videos show patients how they should use the Froggy. I give them, everything is in YouTube, as you will see. They see how they place the Froggy, what is the correct way, how they position their head and shoulders, and they know exactly how to do it. I put also some videos, I send them to do some exercise for those who are very motivated to strengthen the cheeks, strengthen the lips. I have on my YouTube channel, I have a lot of exercise. This is in Hebrew. I have translation of some of the videos to English, so you are invited to follow my YouTube channel, Rafi Romano. And I give a lot of exercise, how they can do everything at home. So now we got to the second part of my webinar, which is case presentation. And Froggy Mouse is really a game changer in my clinic. You can see one of the orthodontic congresses where MedOrd is showing the Froggy Mouse, which became like, one of the best sellers in every congress. You can see me and Guillaume, and while we came to see football in Paris with my two little boys. And I will show you quickly what's happening in my office. Look at this guy. This is again a child. I will start from children and go to adults. This is the guy with mixed dentition. In the posterior, it's all deciduous teeth. This is permanent teeth. You can see him after 3 months, after 6 months, after 1 year, doing nothing, only froggy, nothing. No speech therapies, nothing, 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 only froggy every day for 1 year. This is before, this is after. It's not only closing the open bite, it's not only closing the overjet, it's a complete change of the whole function of the muscles. And this is why you see this change, and he still didn't start orthodontic treatment. Look at another guy. As I told you, the first picture that you do, you see the tongue. You see the tongue popping out without you saying anything to the patient when you take the picture. And when I show the patient, I show this picture, he said, wow, look at my tongue. And then look at him after only 6 months, the tongue disappeared. I take the same picture, there is no tongue anymore. This is before, this is after 6 months. And this is 1 year after Froggy. Again, look at the case. Overjet is closed completely and he's ready to start his orthodontic treatment. Look at this girl, March 2024. As Guillaume told you, all my cases here are completely new. This is few months ago. This girl had also thumb sucking. She was very, very frustrated, her mother, from the open bite, from the tongue, from the thumb sucking. Look at her. I have a lot of tips how to stop thumb sucking, but we will discuss it probably in another webinar. And look at her. This is again few days ago, September 24, after Froggy, stopping the habit. Overjet is almost reduced completely. Overbite is corrected. No orthodontic treatment yet. This is before, this is today. Another case, November 2019. This is before. I sent her to myofunctional therapist. This was before Froggy. This is how she got to me after 1 year of myofunctional therapist. Still, there is improvement, but not a lot. I gave her Froggy. And excuse me, Guillaume, Froggy is one of the most stupid, simple appliance. Genius, but stupid. It's a little plastic. You know, we know that some appliances are so complicated. This is a genius invention, which is stupid. You ask yourself why they didn't do it before. Why? Why only your father was the one to think about it? Look at
Thank
her.
you for these beautiful compliments. And by the way, my father always loved to say the story of how he was discovering the device because it's almost on a stupid way. He was not looking for that. It's what he described as the serendipity discovery. He was
Yeah.
just looking at the patients exactly wearing this device, splitting the lips, and then had the eureka moment, realizing that inhibiting this lip seal was the key to control the swallowing. And this gives me a transition with the question that we just received right now from Lucas Hope, that is asking to you, how can the tongue movements be improved when there is no visible tongue tag at the froggy?
Okay. So let me answer. Let me finish just this case and I will answer. So you can see this is after 3 months and this is after orthodontic treatment. This is here today. Overjet is closed and everything is nice. Now, I get this question a lot. Actually, the froggy is not blocking the tongue. The patient can still push the tongue to the froggy. I don't believe if we have a lot of orthodontists here, if you know the twin block is not forcing the mandible forward like herb appliance. It just encouraging the mandible to come forward. This is what the froggy is doing. The froggy is not blocking. The froggy is just guiding the tongue gently, without any blocking, without just tying the tongue and don't let the tongue move. The shape of the froggy is actually inviting the patient to move the tongue up. And the invitation is well accepted, as you will see. Another case, this girl came to me in March 2018. She's the daughter of a pediatric dentist that used to work in my office. She didn't do anything. This is in 2018. And here she comes to me in December 23, 5 years later. We didn't do anything. And look, the tongue is still there. The teeth erupted. Nothing happened. And still I have a big open bite. Big overjet. Froggy, again, this is only 1 week ago. Look at her. It's with combination of Invisalign treatment, which I will speak in a minute, but everything is closed. Her tongue disappeared. She doesn't have any more need of the froggy. She used it for 6 months and we don't need it anymore. I can see from her lips, from her behavior, we don't need it anymore. This is before and this is after. Look at this guy. This guy arrived to my office after 2 orthodontic treatment. I always present him in my webinars, including the last one I did for Froggy. But look, this is a failure because 2 things were not done. One that I will discuss in a minute, the reshaping of the maxilla, which is very important. And second is teaching the tongue. So here we did combination. This cribs here is not something that I put. It's what the previous orthodontist put here in order to try to fight all this tongue problem. And nothing happened, nothing helped. The open bites still keep opening. So we did here immediately the froggy and then changing the shape of the arch. The guy that asked about the constriction of the corridors, it's not about expansion. It's about changing the shape of the arch. What happened when tongue is pushing forward, that all the rest of the arch is getting squeezed, is getting constricted. As you will see here in a minute, look at the case after around 22 weeks, 4.5 months, half pregnancy. I leave here some attachments here for the retention. So my plastic is actually holding the teeth here, not to move up. And this is probably the most important picture of today's lecture in terms of orthodontics. You can see the necklace here. What happened when the tongue is pushing, look at the bottom necklace. When the tongue is pushing the teeth forward, all the rest of the necklace is becoming narrow. When you take and open the necklace, like in the upper one, all this part is going up. All the overjet is closing, all the overbite is closing. and we get improvement of the whole apparatus, the whole facial circle. You can see him. He is already now 4 years in retention. He is now 22 years old. He's 4 years in retention, doesn't do any froggy anymore, doesn't need any exercises. Finish. Everything is stable already for 4 years. Look at this girl. This girl arrived to my office frustrated, crying. No one wanted to treat her. They say she need orthodontic surgery. Now, like I showed you in the beginning of my lecture, when I did the case in 2018, such a case, I would say, yes, you need orthodontic surgery. Today, I know it's not necessary anymore. I gave this girl froggy. I did orthodontic treatment by reshaping the arch, opening the arch, reshaping the shape of the arch, doing the orthodontic treatment together with the froggy, opening the arch. You can see here how we reshape the arch, getting more width in the premolar area, the cuspid area, and the molar area. But it's not just expansion, it's reshaping, giving a different shape, which, to be honest, happen in kids spontaneously when we give the froggy. When the tongue is going up, actually, all this procedure will happen spontaneously. But most of the patient will not arrive to your office, to me as orthodontics, at the age of 8. They will arrive to the pediatric dentist. They will arrive to myofunctional therapist that should give the froggy as an orthodontic tool, because this is what will happen spontaneously. This is this girl, 5 months later, 23 aligner. Look how everything fit here, all the Invisalign. Look at her after only 23 aligners. With the froggy, she is like the most happiest person on earth. And she sent me a picture of her getting the proposal to get married. And for her, what I gave her is a life change. It's not only orthodontic treatment. Look at all the features, not on the teeth. Look at the hypotonic muscle, which are now very strong and stressed. Look at the shape of the lip here that get here a very nice architecture because the teeth are not proclined anymore. How often you see your patients, and as I told you, when I did only braces, I see patients probably once in 8 to 10 weeks due to the new wires we have today in dentistry. But when I do my treatment with froggy and with Invisalign, I see my patients every week. I give patients a special cheek retractor, which costs nothing. I give them at home, and they send me 9 pictures every week. So I actually see patients every week. There is today also an AI appliance that give artificial intelligence to this picture and can give you guidance if something goes wrong or what is the progress. But only by seeing pictures, look what you can see. Look at this girl with this open bite. Look at her lips. Look at the overjet. And look how nicely I start the treatment. This is treatment, again, combination of froggy, which she got immediately in the first appointment. By the way, look, and this is very typical, the tongue thrust is not symmetric. You can see that the left side is much more open than the right side. And this is something you will see a lot of times. The tongue is a muscle, and also our muscles are not symmetrical. So you can see that some cases have more influence of the tongue on one side than you have on the other side. And look at her, stage number 1. And look here what what follow-up I have from this patient. She sent picture every week. I look at the picture, I put my thumb up, I send her a message, go ahead, go ahead. And for her, it's like 2 minutes every week. For me, it's probably 1 minute every week. And it gives me a satisfaction that I follow my patients. And believe me, those who know me in Israel, I have many patients. I have thousands of patients. So I have enough staff that is able to look at the picture, send comments, and if I need to interfere, I do it myself. Here she is at stage 41. This is her after 40 aligners when I saw her actually every week. This is a very interesting case. This girl came to me when she was 18. And I think it is important to show this case because many of us see patients and we don't see them later. She came to me, she was 18, it was 2015. Look at her. It's a typical tongue thrust, open bite, malfunction of the tongue. Look at the tongue popping out when I took the picture. Look at the overjet. And look at her after a few years. Now she is 22. She came to me. I was too expensive for her doing orthodontic treatment, so she went to another orthodontist. She did orthodontic treatment, came to me, and she said, oh, look what happened. I finished my orthodontic treatment, and now 1 year later, look at the open bite, look at the tongue. And I still have my fixed retainer. And I don't like it. I said, hey, I saw you few years ago. You didn't want to come. You went to do the treatment somebody else. He didn't treat the whole problem. What do you want me to do now? She said, I want you to treat me. I said, no problem. This is my cost and you can start treatment. She said, yes, but you are still too expensive. And I already paid for treatment. So this was 2019. And then she disappeared again. And now she's 24 years old. Another 2 years passed. And look at her now. Now, situation is even worse. She has fixed retainer. She did the orthodontic treatment and the bite is keeping open and open and open and asymmetric, as I said. Now she said, Rafi, whatever you say, I will do. We start the froggy immediately and started treatment. And you see many times the fixed retainer is untouched. People tend to think, well, I have fixed retainer. Why should I wear also a liner at night, retainer at night? I have fixed retainer. And the fixed retainer is not broken. It's still here. You see, it's still here. And look what happened to the posterior part. The posterior part, you remember the necklace, went inside and all this front part went outside. Look at her during the year. This is before treatment. This is after her orthodontic treatment. And this is when she came to me 2 years after she was after treatment. Look what happened to the posterior part. Look at these pictures. Still, all these pictures, I didn't touch her. Look how open bite is keeping open and open and open. Look what we did here. We reshaped the arch. We expanded the posterior part and look at the all change we did here for the arch. This is the necklace concept. Look what happened to the front teeth when we do the expansion. Look at the same in the lower arch. And now, only 24 weeks after 6 years since I first saw her, look at her now. Overjet is almost closed. Overbite closed. Look at her smile now. And this, I promise you, will remain stable for the rest of her life. And I want to conclude with the last case. This case, again, I treated when he was young. And here he is. He finished treatment at the age of 14. And he came to me at the age of 18, 19, starting a little bit opening the bite. And on that time, I didn't know, not only I didn't know the froggy, I didn't understand the whole concept of the malfunction of the tongue and the lips and the shape of the arch. And I put some buttons here on these two upper centrals and button on the lower cuspids and gave him some elastics to wear. And here he is with intermaxillary elastics. By the way, look at the tongue frenum here, how strong it was. And look at the arch. The arch here is expanded. It's nicely, I did a very nice orthodontic treatment, but I didn't treat the tongue malfunction, nothing. And then after I put some elastics, everything was nice. I kept these buttons for another 3 months without elastics just to see if everything is stable. And I released, I took off these buttons and say bye-bye. And then 11 years later, this is a patient, this is 11 years later, and here is a patient. Look what happened after 11 years. The whole arch collapsed. Overjet is amazingly big. Look at the crowding here. Look at the constriction here. Now, a good tip that I want to give you today, again, if you go out from this webinar with one tip, take this one. When you look at this case and you look at this guy and tell him, well, you know, I'm orthodontist, this case cannot be corrected without surgery. Remember, he was 18 here, 19, and he already finished growth. And this was the occlusion. This was the result. So if after 11 years he is like this, no growth happened. It was collapse of the occlusion, collapse of the tongue, collapse of the muscles. Again, in this case, we did the whole protocol that I talked to you. And the beautiful thing here, he's not in Israel. He lives in Berlin. He comes to Israel only once in 6 months. I did the same protocol, expanding the arch, doing froggy, doing exercises, some exercises I send him, doing the expansion, the redesigning of the arches. And there is no such thing as luck. There is work. And if there is motivation, there is success. I gave him elastics to wear to help the expansion of the arches. He sent me pictures every week. I can open like an album now on the whole my room with his pictures. And look at him. Stage 81. This is, you can see the improvement. You can see the before. You can see the after. He is already in retention for some years. Look at the overjet. And look at the shape of the arch. We change or we regain, we bring back the shape of the arch that he had before. So what is the difference? Why this result now, I'm sure, will remain, because now I understand two things. One, I need to address the tongue problem, but address it properly. And two, there is retention for life, follow up for life. There are clear aligners to wear every day, every night for the rest of his life. And then everything will be stable for many years. This is in January 24 when he came to visit Israel. And this is his occlusion. This is before and after. And if you join forces, you and your staff, you and your patient, you and your team, which include the myofunctional therapist, you have a discussion together. You don't just send patient to myofunctional therapist and get him back after 1 year. You do all this cooperation. You are the coach, you have success. I thank you very much, and I open now for Guillaume for questions.
Thank you very much, Rafi. As always, it is super interesting, and you have beautiful clinical cases to show, always new ones for the ones that we're already watching. So the lecture that you gave 2 years ago during the Froggy Days, and for the ones that did not watch it, I highly recommend you to go watch out our YouTube channel, where there's this lecture plus 20 other ones with many clinical cases. I see that it is clinical cases and some very concrete questions that we are mostly asked. There was a lot of questions, but since we were close to be at the end, I was waiting that you finish to present all the clinical cases to ask you all of them. I will directly start with a question of one of our friends from Italy, that is the Dr. Stefano Di Vecchio, that you probably know because I think he was writing a scientific article about the froggy mouth, that is asking if we use a froggy with removable expansion appliance, which also goes with another question of someone that was asking you, how are you making the palatal expansion for most of the patients? Of course, different techniques are always used.
Yes, this is a good question. I don't think that we should interfere with the philosophy of orthodontists. If you want to have my work, the way I work with everything. I expand arch with removable. I expand arch with Hyrex, fixed rapid expansion. I do expansion also with Invisalign, with removable, with plastic aligners. Now, Invisalign came up with this palatal expander, new palatal expander that goes with 3D printing. I don't think it's relevant. If you can achieve a reshaping of the maxilla somehow, then this is the most important. And I do it in combination with the froggy. So if you can do it with removal, you are the orthodontist. If you can do it with the removal, go ahead and do it with the removal. If you want to change only the torque of the teeth, you can do it with Invisalign. If you want to expand the whole palate, you use a rapid maxillary expansion, or in adults, you use with implants and opening also the suture. The idea is to do this expansion, to have this good expansion of the arch.
I see one question that is really often coming back, so I directly ask it. It's a very common question that we often receive. It's, do you believe in that in the contemporary treatments with the froggy and orofacial myofunctional therapy, Or do you think that the only use of Froggy is enough? Because as a speech therapist, I have to admit that I am almost scary about the lack of personalization with the only use of Froggy by the specialist.
I totally agree. I think if you ask me what is the most important factor that make me successful in my clinic, as well, the most important factor, of course, is that I'm so handsome and so beautiful and modest. But the second one is that I am devoted to my patients. And devotion is to address, to look at the eyes of the patient and be there for them. And be there for them, meaning that if I feel that the timing and the motivation is good, and you have to build motivation. Most of the patient that come to you has no motivation, and you have to build it. For me, the Froggy is a way also to build motivation because they need only 15 minutes per day. They don't invest money now on myofunctional therapist, but I will never give up. I think that the combination of the team, the parents, the patient, the myofunctional therapist, me, sometimes ear and nose therapist to open the airway. There is a lot of, but you cannot attack. You know, if you attack with all your weapons, if you come now to a gym and the coach will tell you, okay, we do 1 hour, 4 times a week, you said, okay, okay. And after 2 weeks, you will disappear because you know, from zero, you get to 100. You have to do it slowly and be devoted. You have to feel the patient, smell the patient, and change your routine according to it. So I don't think that by orthodontists that give up myofunctional therapy and say Froggy is, you know, the only appliance, it's stupid. You need myofunctional therapists give so many tools to the patients that Froggy do not even try to address. I think that Froggy helped myofunctional therapists as well to build this cooperation with the patient.
I totally agree with what you said, and if I may add a little word, because we often have a discussion if we are having a big part of our clients and users that are speech therapists, myofunctional therapists all over the world. It's exactly because we are not at all a solution to replace the myofunctional therapist, but at the opposite, to be a tool to be used by the therapist. I think that even though he pretends to be unmodest, Rafi is actually very modest, and what he does on his office is almost an actual job of therapist that he's doing in addition of his job as orthodontist, involving a lot of the teams. That's why we also have some other key opinion leaders that directly have myofunctional therapists inside the office to be able to adapt the treatment to every patient. Because there's something very important that we have to say. We are in France, originally based with Froggy Mouth. And in France, there is something that is very important. According to a recent survey, more than 66% of orthodontists are not able to find available therapists next to them. That's why they are also needing some tools to start the treatments, not to make the whole treatments. I'd like to just share with you very quickly one of the scientific studies that I prefer to show for two reasons. The first one is because they were making the difference between the engram of a new function, which is the ability to do secondary swallowing, for example, and the automation, the fact of doing it every day, all day long, without having to think about that, which is two very different steps on the rehabilitation, and it's very important to state. And this doctor was able to make this study and was on purpose trying to not add active exercises. And what we could see is that we were having very good results to reach the automation on more or less one patient out of two, and not at all on the other half of the patients. That's the most important about Froggy Mouth. If the patient is facing no obstacles, no problems, he can totally be rehabilitated only by Froggy Mouth. And it's probably the kind of patients that you, as a therapist, you would have very quick results also. The second half are the patients that needs the help of a therapist to be able to identify what's going wrong, what's the problem that is blocking them at stage one or blocking them at stage zero, and being able to propose something, propose sometimes an exercise, or refer to the therapist that lives next to your office to be able to help these patients to overcome this obstacle. That's why Froggy Mouth is not at all the therapy by itself. It's a tool that can only be used by practitioners and therapists and used as a tool, understanding how it works to be able to involve all the adequate specialists to reach the targets that we should all have, which is 100% of success rates for myofunctional therapy, and which is exactly what Rafi was stating when he's saying that we need to fix the tongue before starting orthodontics. Otherwise, it is not making sense. What's matter is how we are able to reach this 100% success rate. And there's way more than enough dysfunctional patients to have everybody helping for this very difficult mission. That is leading me to...
Okay, let me just add one thing because I catch two things from what you say. One is I get phone calls probably every week from patients who find my videos on YouTube and they call my office to buy Froggy. I don't sell Froggy. I think that Froggy can succeed only when they see my eyes, when we are becoming a team, when I diagnose the whole concept. This is one thing. And second, I think that, you should remember that one of the biggest frustration that we have is unhappy patient. And an unhappy patient is something that me as a doctor is something that can ruin my day. If a patient come to me and he's not happy from my treatment, from the follow-up, from the relapse he has, this is part of the biggest frustration to you as a doctor. You put your all efforts, the patient paid you, but it's not enough. We want to have success. And I see that malfunction of the tongue and the oral facial muscles is so common and so unaddressed properly. It's not something that we have a webinar today about 2 cases that you see per year, and you ask yourself, why do I spend my time now at the middle of the evening instead of having dinner and watching TV? Why do I spend time? I believe we should understand that this is to help you as clinician to solve this frustration and to help your patients.
Thank you a lot for this precision. That's exactly the purpose of everything that we are trying to give. And I think that it's also the meaning when you are saying that you are not having a big office with 10 chairs. No, you are taking the time to be able to adjust and customize not just your treatment by the choice that you make, but also the relationship with every patient. That's what matters a lot, I think, for many people that listen to us. Another question that was coming back a lot. It's usually something that I do not answer directly because it speaks about a device made by someone else. And I consider that as Froggy Mouth owner, I cannot speak about the other device, but as a practitioner that always made your decision on your own with no influence, I think that you are the best person to answer. The question that was coming probably 6 to 7 times here on the chat, which is why are you using Froggy Mouth and not the Mayo Brace, the Mayo Osa, the Mayo Talea, and all the Mayo Brace devices in general? And are you sometimes using both of them together, like some people do? If yes, when? And if no, what's the reason why?
Okay. That's a good answer, and the good question, and the answer is very, very simple. One, whatever works for me and works good, I don't want to change. And it works good. It's not expensive. It works good. I have good feedback from patient, and I use it all the time. Second, I used in the past MyoBrace, and I use other appliances. I was not so happy from the feedback from patients. And this is why I didn't find a representative in Israel. And we don't have a representative in your country. And you have to call Froggy in France and have a private shipment with all the tax problem and shipment problem. It's better when you have a dealer and you have a good supply. And I order probably every month, I order another shipment. And this is good for me. So if you work I think this webinar,
Rafi,
although
can you
it
move
is
your
paid,
microphone, please? I think that you have a, yeah, just speak again.
one.
Yeah, not,
One. Wait, I'll get more close to
I think
the,
it's good.
yeah, it's better now?
It's
Okay.
better.
So when you uh, uh, when I work with the clients, for me there is a lot of combination. The service, the price, everything. If you work in this webinar, although it is sponsored by Froggy, it's not about Froggy. It's about changing the habit of your understanding of how you treat this problem. If you have a good experience doing the same concept that we discussed today with another appliance and it works for you, why not? Go ahead. I recommend you. I have hundreds of cases. I worked for many, many years. I recommend you to try. Froggy is something that made me happy. And it made me happy long before they invited me to do this webinar.
Thank you very much for this nicer answer. There is a question that was also coming a couple of times, I think, which is if you were having any experience with children with development delay of Down syndrome, maybe with the froggy mouth, because it's the kind of patients that we are also often treating with the froggy.
I totally agree, but I think these patients, which are a big challenge for their parents, for us as clinicians, they are a very big challenge because their tongue is always forward, their lips is always open, or the posture is really, problematic. And for me, and this is what I tell parents, I give them the froggy as a tool to improve a little. We go step by step. I had yesterday, I'm sorry I didn't bring you pictures of this guy. The guy is a guy with autism. When I started the treatment, he was drooling and he was open mouth and a big overjet. I saw him yesterday uh, and he is now 34 years old. And I watch him for 20 years. And I treat him, with all the, uh, full circle of orthodontic treatment, lip strengthening, myofunctional therapy. And now in the last few years, he has a froggy. And the improvement is amazing because he's now grown up and it changed the whole, but it's work. Can take years and step by step. And Froggy is another tool. It's not a miracle.
Of course. There is one question that I think was coming from the moment when we could see that there was some tongue creep. I think that it's
Yes,
from this moment. I don't know where is it
I know,
exactly.
I
Is it,
know.
don't you have a lot of shift to lateral open bites? So I think that this question was coming from the moment when there was a tongue creep. But anyway, the question about the shifting from open bites to from anterior open bites to lateral open bites that
Okay,
actually creates deep bites is always very interesting.
okay. There is a shift in muscle activity. The shift in muscle activity is not because of the froggy. It's sometimes, and this is for another webinar. If you want, we can discuss it in another time because our time is getting short. But we have a lot of changes during our life. Some of it, and I think this is important to say tonight, is from over awareness because we have to be careful. When you start pushing and pushing towards changing the habits, changing the tongue position, changing everything, you may create another problem. The anterior open bite can go to lateral open bite. The lateral open bite can go to complete open bite. The open bite can turn to deep bite because now patient is biting really hard, getting a strong muscles, and the open bite now turns to deep bite. And I always tell my staff, I tell my patients, I tell parents, the beautiful thing about Froggy is they don't think about it. They put it in the mouth, they watch TV, and they don't get over awareness. Over awareness is also dangerous. When patients are doing diet because they were fat, it's nice. When they get into it so deeply, they can get to a really psychological problem. Getting from every 1 kilogram that they gain, they get hysteric and they get too much awareness of this problem. And I think the beautiful thing for me about the Froggy that it comes with their life and not controlling their life. So sometimes anterior open bite can turn to another habit, but I think it is our problem that we put awareness for the patient too much, and now he doesn't know what to do with the tongue. He doesn't know where to place it, and we get all this shift from one problem to another problem.
There is one very interesting question as well that I think also makes a links with what you were previously saying about the narrow palate. It's a question if there is any contraindication to wear the froggy mouth, or maybe not contraindications, but stuff that first needs to be fixed before using the froggy mouth.
The answer is yes and no. Yes, there are contraindications to put Froggy. The contraindication is cases where you don't see any reason for the Froggy. I have a lot of patients that now read about Froggy, and the patient has some speech problem, has some other problem, and they find my YouTube videos and they come to me and they said, my kid need Froggy. And I look at him and he said, you don't need Froggy. You have a beautiful function of your tongue and lips and teeth. You don't need Froggy. So this is contraindication. But if patient need Froggy, there is never contraindication for me. Never.
And there is some people are asking if there is any frenectomy or any stuff like that that we are done before. I just come back on the contraindication because I think that what they meant is also about the what we are calling at Froggy the anatomical state that allows the treatment to start, which means that there's, for example, enough space on the palate to allow the tongue to raise to the top. Because if the palate is really way too narrow, maybe that you are making some expansion before, like you were showing in some cases.
First of all, the tongue is an orthodontic appliance. I don't know if you know, the tongue is orthodontic appliance. So whatever orthodontic appliance that you are going to put, the tongue will create more force. So if you push the tongue up, it will help you to change the shape of the arch better than every appliance that you have. So this is one thing. And second, what beautiful with the Froggy, it's not an appliance that force anything. You know, when you put it, the tongue will slowly, as I said, it's not blocked, it's not anything, it's just a guidance. It's just a recommendation for the tongue. The tongue find it more comfortable to move slowly up. So if there is no space in the palate, the tongue will just slowly try to push up. And then you start the treatment. If needed, you do some expansion. If needed, you do some orthodontic appliance. And then the tongue will go more up. But when you start, it's not only the tongue. When you put the froggy, you strengthen your lips. And your lips are, you also close your lips. You start breathing more from your nose. It's not only the tongue going up to the palate. There is a sequence of things that happen when you put the froggy. So for me, there is no way you fail with the froggy. There is degrees of success.
Um, uh, I fully agree with that. I see one question that was surprising me a little bit, which is the last question. Would you suggest that we should be careful with using active myofunctional therapy? And I think it's not at all what we meant. The opposite, that passive and active myofunctional therapy are very complementary. That what matters again is not the way to reach this functional balance, but the fact that this functional balance is reached. Frogmouth is a tool that has been developed to bring another way of catching the problem of the myofunctional balance. So that's why I think that the question is answered by itself. We're going to take one last question. I'm sorry for the ones that
Yes,
couldn't be asked, but
definitely.
you can all ask them all those questions directly by emails on the contact at frogimouth.com or on the social networks. The last
Or
question is
send me direct question in my Instagram. Yes.
perfect, exactly. The last question is linked a little bit with the question. I just have feedback that the question of my brace with the froggy mouth didn't got an answer before going with the actual last one. I think that if you want to actually get the difference between froggy and my brace, you should listen at how is the froggy mouth working, listen at how is the my brace working, and then make your own opinion on that. What I can just say is that the point of the froggy mouth is to inhibit, and it's the only device for the moment in the world, that's why it is patented, that is able to inhibit the lip seal that is necessary to proceed with the primary swallowing. So froggy mouth is actually controlling the lips to make primary swallowing impossible. This inhibition is, as shown in the neuroscientific literature, very important to reach automation. But this question is also answered in more details in many lectures during the Froggy Days that I am welcoming you to go look at. So the last question, and very interesting theoretical question. I'll look for it because I loved how it was said. Um, I don't find it, but anyway, I remember it because I love the philosophical way. Uh, it says something that works, I think, a lot at the philosophical way, but that we don't like anyway to take the risk. It says that basically, if we're able to bring a myofunctional balance at the end of a treatment, does that mean that we are not needing any kinds of mechanical contention later at the end of the treatment or not, since we were able to fix the etiology of the deformation?
I think this is probably one of the most unanswered question that we have in our professional life. Let me answer this question by posing another question. You learn how to drive, okay? And you drive now amazing. Do you need a seatbelt anymore? Do you need insurance anymore? Why? You know, I'm a very safe driver. Now my risks for accident is probably went down to from 80% of my young son to 10% in my age, maybe 2%. I didn't have, touch wood, any accident in the last 40 years and no, and still I'm working my seatbelt every time I drive. Still, I'm doing insurance for my car and for my family. And I feel that as a doctor, and this is a good question, it's a philosophical question, because for me as a doctor, if theoretically the patient recover his tongue problem, his myofunctional problem, and you place the teeth in a good occlusion with a good contact points, why you need retention? You know, in the past, many orthodontists thought that they don't need retention anymore. 1 year of retainer, and that's it. If you balance the whole forces, there will be no relapse. And they are right. But do you know in advance when you need it and when you don't need it? I don't know. If you know, probably you will be the most wealthy and rich orthodontist in the world because you find the patent to know in advance who will be stable and who will not. I don't find any solution for it, and this is why I give my patients retention for life. I invite them for fully control. I give them the froggy to remind them the myofunctional therapy in the rest of their lives to use it once in a month. Do all of them do it? Definitely not. Do all of them come for follow-up visit? Definitely not. Do I think that I do better job than I did in the past? Yes, I think so. So with that, let me just conclude my part and then you can say bye-bye. It is already 1 hour and 40 minutes of this webinar, and we still have 141 people with us, which is amazing. And I'm really excited. I'm humbled and honored to have all of you with me tonight. And you are invited to contact Froggy to more technical, practical, financial details and to follow me on my Instagram and write me. I promise to answer and I promise to host you here in Israel. And I want to thank you really very much, Guillaume and Daria and MedOd for hosting me.
Thank you so much, Rafi, for always being such a support and good advice because I have to say that I often also text Rafi when I have some questions on some stuff. And I know that my father is part of the 141 spectators that are still there and was texting me
And
during the webinar that it is appreciated.
yes, and Guillaume, one last thing. I just saw a message from Samantha Weaver, one of the probably most talented, teachers for myofunctional problems. And I really thank you, Samantha, for attending this webinar.
I'm sure that I can see from here, from friends, the big smile that she is for sure having right now on the face. Samantha is always a great support for us. That was participating on a couple of lectures that we did there. So I also thank all the previous speakers and thank you once again so much, Rafi, for your time and your commitment to help us. It's so nice,
My
when you are
pleasure.
managing a company like that, it's such a
Yes,
pleasure to see that the
yes,
people are motivated by just doing the stuff because
yeah,
they like that, because that's their
yeah,
passion, and we can feel that. So thank you
yeah.
so much, Rafi.
Good night,
Thank,
everybody.
thank you, everybody, for joining, and we see each
Bye-bye.
other in 2 months for the next webinar.
Bye-bye.